All right, guys, when we talk about the most common complaints that I get on a very regular basis, it boils down to two things. Really, number one, missing the overhead position, but number two, the shoulder pain that kind of comes along with this. When we talk to clients, we'll kind of understand a couple things about them as we go. Number one, they'll also talk about chronic low back pain, which can be on one side or both sides, but then also we'll discover during the course of assessment that there's a difference in the mobility at one ankle versus the other. This is important when we talk about taking a barbell, having it overhead, and doing some sort of squatting motion. Keep in mind that when you squat, you need to be able to bend at the hips, you need to be able to bend at the knees, and you have to be able to bend at the ankles. If you have one ankle that bends better than the other, then you're going to have one knee that travels farther than the other, which means that you're going to have one hip that rotates farther than the other, which turns your torso and actually would bring the bar out in front of your body a little bit more. So as an athlete, what you have to do to prevent yourself from falling over is you have to compensate by rotating hard in that upper back. If your upper back is stiff, this puts a lot of strain on the muscles that lie between your shoulder blade and that kind of hold your arm into place. This creates those sorts of impingement type of feelings that we need to get rid of. So bottom line is, if you go through assessment, if you've tried like everything that you possibly can to try to get your arm to rotate back and it's not necessarily working, we have to look at other places. Most often in the athlete's history, there are sprained ankles or some sort of ankle injury that hasn't been addressed fully that we need to take a look at and we need to fix. We're not going to be able to fix any kind of shoulder pains that you have until we get the mobility of a bum ankle back.